Hello, we're getting everyone connected and we'll get started shortly.
As a reminder, when you enter the meeting, your mic is not muted, so please mute your mics if you would.
Just a couple more connecting here. All right, with that, we will go ahead and get started. Welcome to South Dakota Project Firstline's monthly office hours for August 2024. We're pleased to have you join us today. South Dakota Project Firstline office hours features a different infection prevention education topic every month. This is a safe place for like-minded infection preventionists to ask questions, share stories, and engage in conversations and really learn from each other. A couple of reminders for the presentation session today. Please feel free to submit questions in the comments. We encourage you to share comments, resources, links, stories, conversations, all of those items. The recording today will be shared after the event. And please complete the survey at the end of the event. We work with the CDC and they like to see the feedback from our presentations. So that's very important to us. And we appreciate your feedback. Project Firstline is the CDC's national training collaboration for healthcare infection prevention. The South Dakota Department of Health has contracted with South Dakota Foundation for Medical Care to bring you South Dakota Project Firstline. Let's meet the team. My name is Rebecca Syme. I am a registered nurse, and I'm also certified in infection prevention in the long-term care setting, and I serve as the South Dakota Project Firstline team lead. I will also take a quick moment to introduce the team members who are not here with us today. We have one with a new baby and one just taking some time off, both of which are great. So Val Wagner is another nurse who is on the team. And then we have Jamie Rogenbauer, who will join us occasionally also. And from there, I will let Jess and Renee introduce themselves.
Hi, everyone. I'm Jess Stanko. I am a program director with the South Dakota Foundation for Medical Care and also assist with the Project Firstline initiative. Great to be here. Glad you joined today.
Renee Robbins, team member with Project Firstline, and I am a registered respiratory therapist, pulmonary function technician, and a certified COPD educator. So I'm excited to be here and be part of the team today as well.
Awesome. Renee will be providing today's education. So Renee, I'll let you take it from here.
All right. So today we are going to talk about blood. And our objectives are going to include assuming blood is infectious always, discussing how we can prevent infected blood from entering our body, and what steps we should take when we see blood. Next slide. So we do collaborate with the CDC Project Firstline, and they do have some infographics that are really great to distribute in your facility or setting that can remind your staff and others about the importance of infection control and prevention. And this is one that highlights blood and where it can live, tasks that involve blood, and actions we can take to reduce the risk. Next slide. The CDC also has microalarms available. They're training resources to educate your team on a variety of infection control topics. They're a series of guided discussions that connect infection control concepts to immediate practical value so healthcare workers can recognize infection risks and take action to stop the spread of germs. So they do have a microlearn on blood that's available to you as well. Next slide. All right, so on our first objective, we always want to assume blood is infectious, but why? We can never tell who has an infected blood and who doesn't. A person or patient could very well be asymptomatic. So as a precaution, we need to always take infection control measures and assume that any blood we see is going to be infectious. Being vigilant about treating all blood as if it were infectious, we really do protect ourselves and the people around us so we don't spread that infection to our patients, fellow healthcare workers, or our loved ones. Next slide. So what is it about infectious blood that we're worried about? Pathogens in blood that are most concerning infection risks in healthcare include HIV, hepatitis B, and hepatitis C. There is no cure for HIV or hepatitis B and C, but there are medications that help suppress the virus once you have contracted it. Also, there is a hepatitis B vaccination, HBV, that helps prevent the chronic disease pathway. But none of us want to deal with taking viral suppressants for a chronic condition that could have been prevented. So be safe and treat all blood as it's infectious, always. Next slide. So how does the infectious blood get into our bodies? Commonly through needle sticks, breaks or cracks in your skin, or through splashes and sprays to our eyes, nose, or mouth. We also want to think about what we consider sharp to be. We often think of sharps as needles, and many healthcare workers think I would never get a needle stick, or if you work within the home healthcare setting, you think I rarely see a needle unless it's for insulin or perhaps drug use. But remember, a sharp can be anything sharp that cuts you. You might sit in an old chair and it cuts your leg. You might get a dog bite that breaks your skin when visiting a patient in their home. There are a lot of sharp objects that can break our skin and leave us exposed beyond an actual needle stick. So consider your environmental surroundings. Next slide. What else should be considered when it comes to places we might encounter blood? Waste disposal or environmental services. If we think we're going to encounter blood, we need to make sure we are taking the proper PE for the right task. We might need gloves. We might need gown, gloves, goggles. So consider the task you're doing and protect yourself. Additionally, when it comes to cleaning patients' rooms, consider where sharps or needles might be hiding, like in the crevices of a bed or wrapped up in their sheets. Laundry can be contaminated by blood, soiled laundry, changing patients' rooms. All of those need to be considered. Next slide. So how do we prevent infectious blood from entering our body? Never touch blood without wearing gloves. Cuts and scrapes on our hands can be too small to realize an infectious blood could get into our bodies. If we see blood, think sharps. If we're doing a task that involves a sharp like a needle or other instrument, plan ahead. Do we have a sharps container nearby? Do we have a safe place to set a sharp down that isn't going to get lost or forgotten? And remember, sharps are more than just needles. It's anything that can break our skin. So to limit the spread in the environment and between people, don't touch blood without gloves on. When you see blood, look for sharps. When using sharps, plan ahead. Sharps are more than just needles, cuts, scrapes, sticks from any sharp object. Next slide. So if we see blood, what do? Take proper PPE measures and clean and disinfect the area according to what contains the blood. Remember, if it's a hard surface, such as a lab bench, use the proper cleaning solution in your workplace and know your wet times. Each cleaner has specific guidelines, so know what is required of yours when you use it. If the blood is on linen material, such as bedding or a patient's gown, properly place that material in a clearly labeled leak-proof container. Never carry soiled linen against your body. Do not try to shake out linen, but instead carefully roll it in so that any soiled area is contained and doesn't spread to the air or other surfaces. Next slide. So let's talk about workplace prevention measures. Updated policies and procedures should be available to you if you're working with blood. Know where they are, and every time a policy or procedure changes or is added or removed. Training needs to be made available on that. Policies and procedures in your workplace should include an exposure control plan to identify workplace activities that could put you at risk for bloodborne pathogens. Additionally, there should be policies that directly reduce the exposure to risks, such as clearly labeled disposal bins, sharps containers, and other properly labeled equipment and areas. There should be a procedure for safely disposing of biohazardous waste that contains blood. And always remember, we treat all blood as if it were infectious. So just a reminder on this, policies and procedures help protect healthcare workers from bloodborne pathogens. Does your workplace work environment have a policy and procedure in place? And that's something if you're not sure about, you'd want to ask about or check into. Find out where that is, read about it, and know the procedure and the policy. Next slide. So other prevention control measures include our engineering controls. Anytime you're working with sharps equipment, including needles or lancets, there should be a sharps container available to you. It needs to be puncture resistant, have a specially designed lid that only allows things in and not out. The opening needs to be too small for a hand to fit into to prevent an exposure, and the sharps container itself needs to be in an area that is accessible and noticeable. And most importantly, do not overfill your sharps container. And that's an interesting question. I think we've asked this in the past. Does anybody know when a sharps container is considered full?
About 3/4.
Yep. Yep. So if you notice that it's overflowing, what would you do?
Get a
Replace
new
it?
one and close it very, very carefully, watching out for sharps as you push the safeties in.
Yeah, Tiffany, that seems like such an obvious answer, and you see the team smiles. But what do you think is the number one thing we see when we go to facilities? We assist with HAI and the ICARs, and we also do South Dakota Project Firstline does training and education on site. And what we see is full sharps containers that no one's changing when it's clearly the obvious answer, right?
Yeah, because it's no one's job. That's what I usually find. No one knows who's responsible for it.
Yeah,
And
and everyone's busy, right? I mean, we're all busy, so we just assume that should be someone else's, but no, that's our responsibility.
yeah, infection control and prevention is everybody's responsibility. So if you see something, do something.
Maybe take that a little further, just since we have an opportunity to do some chatting is, um, it seems like the Sharps container is the perfect place to store anything and everything you need to put on a flat surface. We've seen Kleenex boxes, keys, stethoscopes is the number one thing. And we think that's okay. We'll just hang them right over the Sharps container where we're putting, those potentially blood contaminated items in repeatedly, but it seems to be the number one storage location for anything you need a place to set something down. That's where you put it.
So other prevention controls include the Sharps device itself. So using safety engineered Sharps devices help prevent injuries that result in infections with bloodborne pathogens in both patients and healthcare workers. Safety engineered devices include retracting needles, sliding sheaths, and hinged needle shields. Safety features are really helpful when the device is not in use and during disposal. So, you want to put that safety sheath back on when you're done using it and not leave that needle exposed. And I think that's pretty much the normal nowadays, isn't it? Those types of needles.
With a few exceptions of specialty items, that's typically what we go for.
All right, next slide. So what do you do if you're exposed to blood? And we've asked this question well, and the answer's already in the slide here, but if you have a needle stick or a cut, you really need to make sure you immediately wash with soap and water for 15 minutes. And most people question that time, but that is what's recommended in the best practice to make sure that area is cleaned thoroughly after a needle stick or cut. Is everybody aware of that wash time? Or is anybody surprised that it's that long? So taking precautions are great, but if you do find yourself exposed to blood, whether it be through a Sharps injury or a break in our skin or a splash to our face, we need to wash that area for 15 minutes. If it's a needle stick or cut, we should use soap and water for that 15 minutes. If it's an exposure to our eyes, nose, or mouth, we need to flush the area instead. So you want to use clean water, saline, or sterile irrigate to wash or flush the exposed area. After you have washed the cut or flushed area for 15 minutes, immediately report the incident to your supervisor and seek medical treatment. The faster you treat a potential exposure, the better. And, that should be part of your policy and procedure. Any questions on that? Anything
I'll chime in and add to that when we go and do infection prevention educations in facilities and we ask the question, what is the first thing you do if you experience a Sharps or a needle stick injury? And the majority of the audience quickly chimes in. They know the answer. It's report it. Yes, as Renee just covered, reporting it is important, but really we want to emphasize and I think that speaks volumes too, is maybe if your staff thinks that the first thing that they do is to report it, maybe we need to do education reminders to say, well, actually, let's go over the steps of how the first thing you need to do is to irrigate that area, wherever it may be. Maybe that is an indicator to us that we need to get some additional education more often. And I know some people will say, we educate, we educate, we educate. And then I would challenge you to think of, maybe you need to change the way you're educating it. So maybe change your education materials or your processes or your approach.
I do see a comment in there too that just making sure to recheck your policy to see if it says that 15 minutes. So that is a place where staff might go and look. So making sure it's up to date there as well would be a good practice.
Yeah, I do challenge everybody to read that policy and procedure and see what it states. Does it follow these guidelines? Is all of that information available and in there so you do know what to do? All right, next slide. So now we know, what do we do when we see blood? We take the proper PPE precautions to protect ourselves and others, and then we clean and disinfect that area or properly dispose of the item that is contaminated using appropriate disposal methods. Do you worry that you might catch something? Reducing the risk of contracting a bloodborne pathogen by always assuming blood is infectious. This means wearing appropriate PPE, being aware of our environment surroundings, and knowing how to treat a potential exposure if one does occur. So when would you call for assistance? If you don't know what to do, you need to ask. You're not sure which PPE is appropriate? Ask. Not sure how to properly dispose of something? Ask. Afterwards, review your healthcare facility's policy and procedure because that information should be included in there. Do you have all the tools and information you need to do your job safely? Are your facility's policies and procedures up to date? Do they contain all the information you need to reduce the risk of exposure for what you might encounter? So again, it's really important to know what's in those policies and procedures and be familiar with them. And if there are changes implemented by your facility, make sure you're reading those changes and becoming familiar with that new policy. And finally, working as a team, we need to remember we support each other in making the right decisions to reduce the risk of exposure and take pride in infection control. It keeps you, your patient, coworkers, and families safe. So we're all on the same team when it comes to infection control and prevention, and we all play a critical role in making sure we follow those best practices. Next slide. So do we have any questions or comments for the team?
Sorry, Renee. I'm trying to sit over here and keep to myself, but I think about glove use. It might be a great time to talk about glove use, right? So hand hygiene is the number one thing that we see that's missed when we're out at sites. And really thinking about, we want to change our gloves, right? So Renee talked a little bit about using PPE. So if we get blood or other body fluids on them, making sure that we're changing those when we see that they're contaminated, and most importantly, performing hand hygiene before we put a new pair on. So with gloves, when we're using that PPE, we want to make sure we perform hand hygiene before donning our gloves or putting them on. And then if we need to change them, we need to perform hand hygiene in between glove changes and again immediately after we take them off.
And if you tear your glove, you're going to replace your gloves. Take them off, perform hand hygiene, put a new pair on as well. So has anybody ever had a needle stick? I mean, I think working in healthcare, and it depends on how long you've been there, but really, I think at one point in all of our lives, if we do work with needles as a respiratory therapist, I draw a lot of blood gases, ABGs, and it does happen. So 24 years. Wow. That's awesome. And now you know if you ever do get one, what to do. So that's great. Next slide. So as Rebecca stated at the beginning of the presentation, we do have an evaluation for the presentation that we provided you today, and we do appreciate your feedback. So if you could all please take time to complete that. That feedback is very important so we can continue to provide the education that people want to see, hear about, and learn, and we can improve things that need to be improved and take the accolades for things we do well with. And we do have a few reminders we'd like to go over with you before we end the session today.
Sorry, I moved past that. Did everybody get a chance to scan this code? It is the only place that we have it, and we would love for you to do it. So I'll give just another moment here for anyone else to catch up on the scan for that.
I might jump in quick too. I know some of you oversee many staff members at your facilities and locations. Keep in mind today's recordings are available on our website, and this is a great educational event or video that you can share with your teams in any of their settings, able to be downloaded and utilized how you need.
And also, if there's specific training you'd like to see presented on office hours, you can share that with us as well in that evaluation. And we're more than happy to bring information to you that you'd like to see more of.
Great stuff. All right, I'm going to advance and let Renee take over where she was, or I'm going to try to, sorry.
So just a few friendly reminders. With South Dakota Project Firstline, we've done a lot of work with infection control and prevention training and education. And they have put together a great infection outbreak unsolved case file. If you haven't heard about it yet, it is really, really interesting. It's something that you can request. We will send to you. It is free. It's an opportunity to engage your staff members in infection control training. So if you'd like to request your game today, that link is there, and I think we're going to share that in the chat as well. And Jess or Rebecca, did you guys want to speak on APIC at all?
So if you're not already a member of the APIC South Dakota chapter, or a big plug for that, join us. We're doing great things. Right now we are conference planning. A link to the conferences there as well. So you can follow those links. Maybe Jess is going to kindly drop them in the chat since I have a lot going on my screen and I don't want to mess something up. But yeah, for sure. So the APIC conference will be held October 3rd and 4th in Sioux Falls. We have great speakers from across the nation that are going to be presenting on infection prevention topics there. I don't know if you've been to similar conferences, but they are just fantastic. You can learn and collaborate and share and just really connect with like-minded people, and they're so awesome. Jess, I'll let you add anything to that.
If you haven't joined APIC South Dakota, the chapter, also that is a great opportunity to really become an APIC member and support our local chapter in South Dakota. But we are very, very excited about our upcoming conference. This will be our first one, and the lineup of our speakers, like Rebecca said, is really going to be a great, well-rounded conference, and there will be CECs available for those of you that have your certification.
And speaking of CECs, we do have our Project Firstline infection prevention training, and there are free dental and EMS credits available. So you can also scan that QR code or share that with anybody you might know that might want those credits, EMS, dental, or just take the training for your own personal benefit. You can always go to sdprojectfirstline.org as well and look at our website and check everything out. We've got a lot of great resources and trainings there for you.
Yes, awesome. Awesome. That was a lot. Thank you all for being here today. One last chance for anybody to ask any questions they may have from today. No? Well, perfect. Thank you all for joining us for today's August issue of South Dakota Project Firstline's office hours, and we hope to see you all next month. And again, you can reach out to us on the website if you have any questions that come up afterwards. With that, thank you.
Thank you, everyone.